Good afternoon, everyone. Thank you for joining us today. My name is Lori Byrne, and I'm with the University of Nebraska Foundation. I'm excited that so many of you were able to join for this webinar to hear members from the Buffett Early Childhood Institute share with us the work they are doing on the impact of COVID-19 on early child care and education. As many of you already know, the Buffett Early Childhood Institute is an innovative research, practice, and policy institute of the University of Nebraska with a mission to transform the lives of young children by improving their learning development. During these uncertain times, everyone has experienced a level of change and disruption, and young children are no exception. Today, we will learn more about the impact of the COVID-19 pandemic is having on early care and education and the role that the Buffett Institute plays. Before I introduce our speakers today, I have a few housekeeping items to go over. All attendees have been muted and their video has been turned off. Following the presentations, there will be time for Q&A. You may submit a question at any time during the presentation using the Q&A function of the webinar platform. If you look at the bottom of the Zoom window, you will see the icon that says Q&A. If you click on that, you can enter a question, and you can also see other questions that other attendees have entered. Please be sure to use the Q&A window to submit questions. We will not have the chat functionality available today. So we will try to address as many of these questions as possible. Also, for everyone's knowledge, we will be recording this webinar, and a link to the recording will be sent out to attendees via email after the session and also could be posted publicly. Now, I'd like to introduce our first speaker. Kathleen, or as we call her, Kate Gallagher, joined the Buffett Institute in 2018. Her work focuses on developing applied research and evaluation studies involving children from birth to grade 3. Their families and their early childhood professionals who care for them along and teach young children. Gallagher began her affiliation with the Buffett Institute in 2016 as the Seal and Ron Williams Community Chair for Early Childhood Education at the University of Nebraska at Kearney. Gallagher has more than 30 years of experience as an early childhood professional and educational psychologist, including teaching, home visiting, and learning early childhood programs in early intervention and inclusive preschools. Before coming to Nebraska in 2016, Gallagher spent 13 years at the University of North Carolina at Chapel Hill, where she taught in the School of Education and served as a research scientist at the Frank Porter Graham Child Development Institute. Gallagher holds a doctorate in educational psychology and human development from the University of Wisconsin-Madison, earned her master's degree in educational foundations from Marquette University, and her bachelor's degree in early childhood education and special education from Cardinal Stritch University. Kate was the lead designer of the Nebraska COVID-19 Early Care and Education Provider Survey that was aimed to increase understanding of the concerns and needs of those providing early care and education in the early days of this pandemic. More than 2,100 surveys were completed to help us understand how providers in family childcare homes and childcare centers are experiencing the effects of COVID-19. I will now turn the presentation over to Dr. Gallagher.
Thank you, Lori, and welcome everyone to a conversation on this beautiful Friday afternoon in Nebraska. I'm going to take just a moment to upload my presentation here. Should be good to go. And we are? Great. So I want to thank the entire team at the University of Nebraska Foundation for providing this opportunity to participate in a discussion of how the COVID-19 pandemic is impacting the early care and education field. I'm sharing what we were able to learn about childcare providers and how they were doing in the early days of the COVID-19 response. Inspired and informed by colleagues around the country who were seeking information to learn about and support the early care and education industry, we sought quickly to learn how early care and education providers were doing, how they were experiencing the effects of COVID-19. Our primary goal was to understand what they were experiencing, how they were doing, and how we might mobilize to address their needs and concerns, and also elevate potential policy responses. An important consideration is that this was in the early days of the US pandemic response, the week of March 16th. At that point in time, there were few cases in Nebraska of COVID-19. So a brief overview of what we did. We used a 12-question survey, which was vetted and refined in collaboration with our partners. We released it via multiple social media channels and distributed it to the Early Learning Connections coordinators, Nebraska Extension coordinators, and our early childhood system and agency partners. Multiple organizations helped distribute the survey. Released in the late afternoon of March 20th, over 500 respondents had completed the survey by sundown. 5 days later, we had over 2,000 responses. This type of survey distribution isn't designed to be systematic and scientific as an approach and produce research journal articles. It's designed to hear from as many perspectives as possible in a short period of time to achieve quick turnaround for applied important purposes. To address our most pressing need to assess the needs of those providing childcare, we analyzed 4 groups of providers: family childcare administrators and teachers, and childcare center-based administrators and teachers. An initial set of roughly 1,500 respondents met this criteria. In terms of what they were experiencing, a majority of providers, even at this early date, were reporting that families were keeping their children at home as a result of coronavirus risk and fear. Furthermore, they were experiencing reduced income due to this decreased attendance, and families were keeping children home, as well as there were increased requests for school-age childcare and for caring for children of essential workers. Drawing on the multiple choice questions and the open-ended responses regarding their concerns in the context of the virus, providers shared that they were coping with incredible stress levels linked to 3 primary factors: economic uncertainty, health threats and concerns, and a lack of reliable information. I'll articulate each of these and what we learned. First, economic uncertainty and economic stress. Already at this early stage, providers were experiencing serious economic stress and uncertainty. They were worried about paying their bills, their staff, their rent, or their mortgage. Providers, even at this early stage, were expressing concerns about their economic viability at this time, such that less than 25% of providers thought their program would survive a closure of 2 to 4 weeks. Childcare businesses, as many of you well know, don't have padding to sustain crises such as these. Administrators reported that children's absences were associated with reduced program income. This was in part due to policies that prevented childcare subsidies from being paid to providers based on children's attendance rather than their enrollment. To summarize what we learned that providers were needing at this point in time, providers need modifications, needed modifications to childcare subsidy funding regulations to allow for enrollment-based payments and waived parental copays. They told us they needed access to unemployment compensation. They needed access to grants to cover salaries and rent and mortgages, and they needed funding to cover cleaning supplies. The next area of stress highlighted by providers were the logical but serious stressors associated with health threats of the coronavirus. First of all, providers made it clear that social distancing does not work with young children. For example, they pointed out that keeping toddlers 6 feet apart is not a reality. Their health worries dominated their concerns. Almost all of the center-based teachers reported that they were worried or very worried that families would bring sick children to care because their parents needed childcare in order to work. And the lack of unemployment benefits, which was already an issue in the childcare field, is very high stakes in the context of the pandemic. Yet 70% of childcare center administrators reported that their staff don't have access to employer-sponsored health insurance. And in addition to not having employer-sponsored health insurance, they don't have sick time to cover an illness such as the coronavirus. Now, keep in mind that close proximity and physical care are an essential part of caring for and educating young children. Yet less than 3% of family childcare home providers and less than 25% of childcare center respondents reported having paid sick time to cover an illness of 2 weeks, such as the coronavirus. Childcare providers were also focused on the health and well-being of the children they serve. They were already having difficulty getting milk, accessing and affording cleaning supplies, and they needed supplies to increase the rigor of cleaning in the midst of a pandemic. And they were having a very difficult time getting up-to-date health information consistent with their program type. So what we shared forward regarding their health concerns and needs was that they need health care. They need paid sick time. They need access to personal protection materials. They need nutrition information and some policy flexibility in providing care. They needed access to funding and access to cleaning supplies. And they need current, up-to-date public health information. I've given a few examples of the lack of reliable information, but this emerged as one of the important things they really wanted to share in this context. Providers reported lacking information from reliable sources. So at this point in time, they were primarily getting their information from media outlets and government websites, and less from their partners in health and childcare. So even the information they were getting wasn't specific to their needs as childcare providers. They told us they were turning to fellow providers for hearsay information. They desperately wanted to hear from their licensing and childcare specialists. And they were experiencing a lot of frustration with digging through websites and documents to find the information they needed. So in terms of information, what we shared forward is the providers need rapid, reliable information. They need more specific guidance for their particular field. And particularly, they asked for information from people rather than just always from websites and documents. And they needed information about unemployment compensation and small business loans, even at this early point in time. In the few weeks before the survey, but in the weeks before the CARES Act was passed and implemented, these were the needs and asks that we brought forward to partners and stakeholders in the state. First, the provider's most pressing needs were income replacement, whether closed or not, continued income through child care subsidy, rapid, reliable access to information. They need their health care expenses and sick leave paid. And they needed resource and financial assistance for food and cleaning supplies for the children they serve. To carry this information forward, we held an initial meeting with organizational, agency, and funding partners to discuss these needs and possibilities. NCFF, that's Nebraska Children and Families Foundation, initiated a statewide partners meeting with a focus on leveraging and supporting our regional early learning coordinators and their connections. Daily for weeks, Nebraska Children held a huddle meeting at 8 o'clock in the morning, typically with over 50 statewide participants, sharing successes, updating. These 4 items led the content and assigning next steps. So identifying small gap grants, which were provided to over 700 providers and privately funded in the state. The governor eventually initiated an executive order that was issued for child care subsidy to be paid to providers on the basis of enrollment rather than on attendance. The information networks that have been established and expanded have provided a wealth of resources. And in particular, and powerfully, there is a nascent child care referral website that has launched in Nebraska. And finally, supply sourcing has been aggressively expanded. You know, we've had some amazing responses from Nebraskans on some of these needs. In particular, a pharmacy in Ogallala is getting hand sanitizer to all child care programs in their area. And as another example, many providers were having difficulty accessing working thermometers for weeks. So one of our Buffett colleagues found a source through UNMC, emailed Nebraska Children. Nebraska Children leadership said, "How much are they?" And at $45 a pop, they said, we'll take 1,000 and find a way to pay for them. So while the coalescing around supporting providers in this pandemic has been outstanding, some serious gaps remain. First, this is a serious issue to continue addressing in Nebraska because compared to other states, more of our providers currently remain open. In fact, 85% of Nebraska's licensed childcare providers are still providing care so that their communities can not only have the health care they need for essential workforce and so that they can keep their communities as open as possible economically. But the majority of providers in the state still do not have health insurance or paid sick leave, which is unimaginable in the context of this pandemic. You know, over 750 providers responded to the open-ended question on the survey. You may know in the survey world, people tend not to always respond to those open-ended questions. 750 responses, and they shared their serious questions and concerns. In the words of one childcare administrator, we're attempting to support the essential workers of our society while balancing the economic health of our business, while balancing the physical health of everyone involved. It's an extremely fine tightrope to walk with no preparation or experience involved. It's terrifying. With our partners, we're talking about next steps and our need to know how providers are doing now, almost 2 months in, and if they're experiencing relief from supports. We hope to conduct surveys and research to learn how working providers are accessing their essential needs. We're working on refining how we can find out how they're benefiting from relief supports and the emergency relief, such as the emergency relief grants and the CARES Act and others. We're working to learn how providers are experiencing economic disruptions. We know many of them are already struggling to pay their bills. And we're working to learn how providers will be able to continue to provide childcare after we see relief from the pandemic. This effort's provided information for all of us to better focus our efforts on providers' needs in the context of COVID-19. And this project was reliant on incredible collaboration of these Nebraska partners and our Buffett colleagues across programs. I want to thank you so much for your time listening. I look forward to your questions, and I'll turn the presentation back to Lori.
Thank you so much, Dr. Gallagher. That was very insightful. We appreciate your analysis of those survey results. I would now like to introduce Dr. Sam Meisels, who will speak on the effects of COVID-19 on early childhood. Samuel J. Meisels, one of the nation's most accomplished and respected early childhood voices, is the founding executive director of the Buffett Early Childhood Institute at the University of Nebraska and holds the Richard D. Holland Presidential Chair in Early Childhood Development. In 2019, he received the Visionary Leadership Award from the Sims Mann Institute, one of the highest career honors given to early childhood experts. Meisels came to Nebraska in 2013 after more than 11 years as president of the Erickson Institute, one of the nation's foremost graduate schools in child development. In addition to serving as founding executive director of the Buffett Institute, Meisels holds appointments on all 4 University of Nebraska campuses as professors of child, youth, and family studies at UNL, public health at UNMC, education at UNK, and public administration at UNO. One of the nation's leading authorities on the assessment of young children, he has published more than 200 research articles, books, monographs, and assessments. He holds a bachelor's degree with high honors in philosophy from the University of Rochester and a master's and doctoral degrees from the Harvard Graduate School of Education. In 2010, Meisels was awarded an honorary doctorate in humane letters from Roosevelt University in Chicago. Dr. Meisels, we look forward to hearing your thoughts on the effects of COVID-19 on early childhood. Dr. Meisels, the floor is yours.
Thank you. Good afternoon, everyone. I want to start by thanking Lori Byrne and Rose Edzi of the NU Foundation for organizing this webinar and all of you who have joined us today. I also want to acknowledge the work of my colleague, Kate Gallagher, The survey that she and her colleagues described today was unprecedented in the nation. There was nothing that was done as comprehensively, as quickly, or as accurately as what you've heard today. It opened a window on understanding the early impact of the virus on the entire Nebraska early care and education sector, and also provided insight for others around the nation as they too were dealing with very many of the same issues. The emergence of COVID-19, certainly an understatement, has affected us all, which is why we're all in different places today watching this. And I too am alone in my office here at the Buffett Institute, but not all in the same way. We know frontline medical professionals take their lives in their hands every day, that they are trying to save other lives. Schools and colleges have been forced to close. Teachers and professors were told to begin online instruction, although many of them had no prior training in remote teaching. Students have been deeply affected by school closures, both intellectually and socially, emotionally. Some of these students have experienced disproportionate impact of distance learning because of their family income, parental stress, food insufficiency, inadequate housing, and other factors. Employees have been laid off. Employers who own business suddenly have no revenue. Parents are at home with their children all day. They love their kids, but there is a limit. Single parent families especially, those who have to work, have been deeply burdened by this. Families without access to digital devices or Wi-Fi, who have to help their children learn, are frustrated, and childcare workers are caught in the middle of all of this. That's what I'm here to talk about today, though each category and more that I have not mentioned have their own issues. Childcare has been thrust into a moral and existential dilemma. I see this in the results from the survey that Kate gave us of teachers who are fearful for their lives, who are fearful for their children, as well as teachers who are fearful for themselves, not only their health, but their economic well-being. So here's the dilemma. If you continue to operate, as we see most childcare programs, centers, homes have been doing in Nebraska, you're knowingly putting three different groups at risk: children, adults, and the community. For children, Chinese researchers from Wuhan, in a recent paper, tell us that children at all ages are susceptible to COVID-19, though pediatric patients are generally less severely affected than adult patients. But very young children, particularly infants, are vulnerable to COVID-19 infection. Adults, there's strong evidence for human-to-human transmission. Of course, we know that now very, very clearly about COVID-19. This includes child to adult and adult to child transmission. So this would mean contact with teachers, with parents and staff at the childcare home or center, as well as with other children who may carry the infection to additional homes. And then the community. The problem of transmissibility to older adults and those who may have underlying health conditions is well known. Grandparents and any adults with respiratory illness and children who may have compromised immunologic conditions are especially at risk. But as a childcare director or owner, if you close your doors because of these reasons, you place yourself, your employees, and also the families of your children who you're caring for, and the potential future of your program at economic risk. Think about it this way too. The annual pay or income for a bachelor's prepared early care and education teacher in Nebraska is less than $19,000 per year, which amounts to less than $10 per hour. Childcare centers and home-based programs are usually operating overall on a razor-thin margin economically. And we've already heard from Kate about the health and unemployment benefits that our early care and education staff typically have trouble receiving if they get it at all. That's why not providing care is such a difficult and a perilous decision, because there's nowhere else to go to be able to pay your bills, to be able to buy food, to be able to put gas in your car. Now, as Kate has also pointed out briefly, the federal economic stimulus program, the CARES Act, has been of great assistance to early care and education, as it has been to many, many other industries and businesses and programs. But it's only temporary help, and at best, it's roughly at subsistence levels. So where does that leave us? Shortly after Nebraska went to its form of social isolation that we call directed health measures, a child care director from a small town near Lincoln wrote to our Facebook page at the Institute, and she asked a number of questions. Here's some of her questions. She says, why are infants, toddlers, preschoolers, and child care providers less important than teachers and children in grades K to 12? Why are local businesses and parents locking their doors downtown and not allowing anyone inside except by appointment or to be met at the curb? Yet we are opening our doors every single day and letting in 10 tiny children who can't wash their own hands, who continuously lick and touch everything and anyone in sight, and can't distance themselves by at least 6 feet. It doesn't matter how big the classroom is, kids play together closely. They kiss babies, they touch babies, they give babies toys, and the baby puts the toys straight in their mouth. I pat a baby's back as he or she licks my shoulder, and then move on to the next baby who will do the same thing. This is the reality of early care and education. She wrote this post to us 6 weeks ago. We still don't have answers to most of her questions. If childcare workers are essential, because without them, other essential workers would not be able to do their jobs, and there's no other place for them to go for the income that they need to survive, why are they not treated as essential workers? Some essential workers, not all, receive hazard pay. Childcare workers don't. Most essential workers are supplied with personal protective equipment, PPE. We all know what that is now. Childcare workers aren't. Even at grocery stores and supermarkets, cleaning supplies are available by those proprietors to keep things clean and relatively safe. But most childcare programs don't have access to these supplies or the money to buy them, nor does childcare have access to sufficient food and other materials to keep their children safe and comfortable. We've been told that group size should be reduced to 10 children in a group. But this plan may not be financially feasible for some programs, and that may actually be too large, given the emotional trauma and strain both adults and children are experiencing. We've been told that children should maintain social distancing of 6 feet, but babies don't do social distancing, as our friend told us in her Facebook post, nor do older preschoolers. We've not been told what to expect will happen with children who are too young to be left unsupervised, but are too old for childcare. Let's say children between 6 and 12 years old. As one commentator noted, are early learning workers really essential, or are they disposable volunteers on the front lines of a pandemic battle? At the outset, I said that childcare is faced with a moral dilemma. The people in the childcare world must decide which is of greater value: the lives and well-being of children, staff, and others who come in contact with their program, or the economic needs of their workers and themselves, and the pressing concern to have a place for young children of frontline workers. There is no easy answer to that question. From this perspective, childcare overall is in really an untenable position. And this is before we even acknowledge that the cause of the rapidity of brain development in the first 5 years of life, the early childhood workforce is our most important investment in our most important asset, the mental and emotional development of our next generation. So what to do? For those who choose to remain open or to open for the first time, let's say around June 1st, which is something that I am hearing a lot of, we would like to propose that there be strict guidelines that protect as many adults and children as possible. Following recommendations that I've seen come from the West Side Public Schools here in Nebraska in the Omaha area, I'd like to see the following guidelines followed. Only reopen those programs that are licensed and in good standing with the Department of Health and Human Services. Parents should drop off and pick up children at the front door rather than going into the program, and they should maintain social distancing from themselves. Each child, and here's something that I've never been completely convinced of, but each child should have their temperature taken before entering the site. I'm not convinced of it for two reasons. One is that it is a moment in time. You may not be okay later, you may not be okay the next day, but it also does say to the child, this may be a dangerous place. It's hard to know how that's interpreted, but this is what is typically proposed. Only 10 children or fewer in a single classroom. Smaller ratios for infants and toddlers are what we need. No combining of any classrooms or groups. Specific staff to be assigned to each classroom in order to minimize exposure. If possible, reduce the amount of time of care to 6 hours or less. Each classroom should be assigned its own toilets, its own restroom. Classrooms will be cleaned thoroughly every day and throughout the day. Strictly maintain all sick policies. All meals and snacks should be served to children in their classrooms. Playgrounds and gyms should be used by only one classroom at a time. All regulatory policies and procedures set by the Department of Health and Human Services should be followed. And to these I would add, be prepared to close if there's any outbreak of disease among staff, children, or children's relatives who they are living with or seeing frequently. This set of guidelines, which basically others have put together, I've added to, colleagues of mine have made suggestions to, there's nothing official about them, but this set of guidelines might give us what we could call the least worst solution, though better solutions may exist. Rhode Island, the state of Rhode Island, is the only state that totally closed all childcare when COVID-19 became evident throughout the nation. They put in place a system in which providers are matched with individuals to provide care in homes. I like this idea. But here's my final thought. As a nation, we have not prepared for this pandemic. That is exceedingly obvious to all of us who watch the news. Sadly, we have also not anticipated what is necessary to care for all children in the first 10 to 12 years of their life. We need to develop criteria for access to emergency childcare programs like those I've just given you. These criteria to be used when priority workers have no other options. But most of all, we need to relieve childcare of the burden it is carrying. It's time to care for those who care for us. We're going to turn now to your questions, and my colleague Erin Owen will lead this.
So,
Thank you, Sam. Go ahead.
I was just going to jump in with some additional housekeeping comments. So thank you for those thought-provoking commentary, Dr. Meisels. We appreciate it very much. So as Dr. Meisels mentioned, we'll move to the Q&A portion of the presentation. As I mentioned before, if you have a question, there's the Q&A function at the bottom of the webinar platform. You can see that there's been questions already entered. Go ahead and add your questions at any point in time. We will try to get to as many of them as possible. And now I'd like to welcome Erin Owen, who's the Director of Communications and Marketing for the Buffett Institute, who will facilitate this portion of our presentation. Erin.
Great, thank you so much, Lori. There's great questions here, so we can get to it. In Kate's presentation, one of the first questions asked, is the stress from this pandemic spilling over from parents and providers to children? Kate.
Thanks, Erin, and thanks, Sam, for your comments. Yes, they told us exactly that. We actually asked them if there was a chance that the stress would be spilling over from parents and providers to children. The teachers reported most highly that, and in majority proportions, that they actually already saw the stress from adults spilling over to children and stressing them. So there's no way that children will not experience the stress that their parents, their families, and that their childcare providers are experiencing. We can't make that stress go away, but we need to be really attuned to providing very high quality care and being ready to help children heal after this is all over.
Can I add something to that?
Please.
May I?
Please.
During times like these, there haven't been times, of course, when there's been a pandemic that has closed down our whole nation at once. But there have been times during recessions when people have lost their jobs, have been out of work, and have not had much hope. And at times like that, there is great stress in families and great difficulty often for children and the parents who are there. So whatever you can do to stay in touch with families who you think may be experiencing a lot of stress, or families that actually don't have sources of income all of a sudden, do it. Do what you can, because you'll be helping many, not just that person, but that person's spouse and family.
And thanks, Sam. And one more thing on this, Erin, is that Nebraska Children and Families Foundation has been gathering resources for families and for early care and education teachers, providers, to help them specifically with the stress in their lives during this time. So looking at the Nebraska Children website is also a great idea.
And we'll be doing a follow-up email to all the attendees. We could add that the FF website to that email for everybody. Okay, moving on to the next question. Is there how providers will be able to continue get cleaning supplies and protective equipment, especially now that communities in Nebraska are somewhat opening back up and will need more childcare?
Do you want me to jump in there?
Both of you.
Okay. I don't really know is the answer. This morning I did speak with the superintendent of schools and several senior staff from the Ralston Public Schools, and they and other districts like them, where the pre-K programs and younger than that as well are associated with the public school, they're going to have an easier time of getting cleaning supplies, clearly, because they are operating within a larger system. But for childcare programs that are not connected to something like that, I think it could be hit or miss. And I'm wondering whether Kate knows of any other organizations that are trying to fill in that gap.
I'm going to say, Sam, that all of our efforts up to this point have been emergent and in response to COVID-19. I will tell you, in general, early care and education programs across the state, unless they're associated with a school district or some more formal entity, are on their own for getting their supplies and getting their protective equipment. And so going forward, there is not yet a system in place to make sure that providers have what they need. It's a need right now to help coalesce that and find those resources, so that it's not always an emergency response, right?
Right.
And that we don't have providers getting hand sanitizer from a pharmacist who decided to just go ahead, like the examples you were talking about, Kate. It's very haphazard and filling in the blanks where people can. All right, here's another question. What do we need to do in Nebraska to get childcare right for both the children and the state?
Hmm. Sam, I'm going to have you hop in on the Workforce Commission. So we have created with our statewide commission on the workforce a plan for what it's going to mean to bring the birth to 5, especially childcare system in the state together. The goals include ones that are about economic sustainability, about providing providers what they need, both in terms of education, preparation, compensation, and benefits, as well as ensuring that they're well. It's a multi-systemic intervention that honestly the Institute was just undertaking with statewide commissioners when this COVID hit. Sam, you've probably got more than that on it, yeah?
I can add a little bit more to that, Kate, which is to say that I think that that this crisis for childcare demonstrates that childcare is not being seen and being operated as a system connected to many, many other parts of our economy and of our well-being. Childcare, you know, is funded. The largest funding of childcare comes from the pockets of parents. There is federal money, there is state money, there is foundation money, all different parts, but there's not an organization of those economic sources. And even then, childcare is related to the training, to the preparation, to the higher education. It's related to the licensing, to the regulatory, and it's related in large part to all of us saying we must have something that works for our children and for our families. This is a time in life where 90% of brain development occurs, and yet it's a time of life that people try to pass along to someone else to have responsibility for, that is policymakers. It's a time for our policymakers to join with us to try to create a system of care that will be able to withstand and be resilient at moments like this. And I think there's a lot of willingness in this state to do that. And we want to take advantage of that willingness and that public will and commitment as soon as we can.
Sam, some of our colleagues in the partner group that we meet with have a phrase called "build back better." Do you have any, I mean, it's along the lines of what we're talking about here. Any comments on that as kind of a rallying cry for the state?
Well, I think when I think about what childcare is going through right now, and when I think of the metaphors that are used by policymakers and some of our politicians of this being a war, and in some respects by medical professionals as well, it's a war they fight every single day. I worry that this war will leave childcare in poor condition. And we will find that there will be some people who will not return to jobs in early care and education because they want something with more stability, something that they can rely on more, that isn't going to be, that will pay them benefits, that will allow them to have sick days and so forth. And so I think build back better is to say, do not be satisfied with just starting something up in order to give children a place to go while their parents are able to return to work. Let's start something up that we learn from this experience and from others that tell us how to make this as good as we can make it.
Can I add something there?
Please, Kate.
Thank you, Sam. I think part of our challenge in thinking about Build Back Better is that our society has not really recognized what people who provide childcare do for the economy and the health and the well-being of our communities, our states, and our nation. And we have never prioritized the care and education of young children as something that is valued. And that, if people can't see now how badly that needs to shift, I don't know what could work. We have to start making the investments that other countries have made for prioritizing the education and care of young children and the people who do it. And it's just, I wish if there was something good to come out of something so horrible, that would be one of the things that happened, that we would start to shift in our public perception and investments around early care and education. That would be what I would wish.
And one of, when Sam brought up Facebook, the social media channel, has been a way that we've been hearing from providers in addition to the survey that Kate authored. And we have had providers saying, I am one kid dropping out from losing my business, which means I won't be able to pay my mortgage. And then so you have the pressure of that. They have absolutely no safety net. And then you have, and you've heard Sam talk about this, the safety of those children and the providers. So Sam and Kate, can you talk about this push and pull of providers who have almost no safety net, no health care? They are on a shoestring. And yet we have essential workers who need childcare. And then we have experts like Sam saying this is dangerous for people to be close together. Can you talk about that absolute conundrum?
Well, it is a conundrum. It is a puzzle. How do we solve this puzzle? In the work that we've done here at the Buffett Institute, with the collaboration of many others around the state, we have put together a proposal that we made public just last January, roughly a month or so before the world started to totally change beneath our feet. And in that proposal, we are talking there about what it would take over a 10-year period to truly change the economic status of the workforce. And what actually what the amount comes to something that is reasonable when you put it all together. But as Kate was saying too, this is not just an issue for the people working in this industry. I'll use that in quotes, or in this system, and I'll use that in double quotes maybe. Rather, this is economic issues for everyone who depends on this. In small towns in this state and in other states, if there is no early care and education and quality care and education, it's very, very difficult to recruit and retain workers in the childbearing years and have that small town be vibrant and be alive. This is one of the things childcare does for us, aside from the fact, as I mentioned earlier, that this is a critical stage of development and we should be giving it all our best. So that's part of what we hope, in fact, will be highlighted by these issues, these problems, once we have our life and death issues under control. Kate, can you add to that?
No, that was, I feel like you captured it, Sam. Yeah, no.
Okay, and we have a specific question here, Sam, that I can tell you is relevant. The World Herald had called the Buffett Institute. Kelsey Stewart will have a story in the paper tomorrow talking about how parents are going to start coming back to work and they're going to be looking for childcare. And she was asking the Buffett Institute, how do we think that, what is the environment going to look like? The question here is there an ideal number of children and staff who should be allowed to be in a preschool classroom while the pandemic is taking place?
I don't think there's ever really an ideal. I mean, it happens that the governor in an executive order some weeks ago said the group size should be limited to 10. But I think he's now talking about 15. This is not the way to set up childcare through executive order, needless to say. It should be small. It's small, that's for sure. And what I think is that if children have been at home with their mom and dad and siblings possibly, and the dog and the cat and everything else like that, and now the parents are going back to work and the child is going to go to childcare, we need to be very, very sensitive. This is a time when childcare and parental working hours should be adjusted so that it is gradual. Think of it as the first time you ever take your child to childcare. The very first day the child's in childcare, most parents don't leave their kids there for a whole day while they go to work. They'll do it for gradually for a period of time, and then over time increase that. I think that we have a limit of 10 that we were given. We would do better perhaps to do 5 to start, and then to continue to add more as children become more settled and the routines become better known. But it has a lot to do with the size of the program, with what kind of program it is, whether there are other adults who are present as aides or as co-teachers, all that kind of thing.
And we have another question here that actually relates to something we heard on a partners call this week, where there are some COVID cases showing up in care centers. And so the question is, what should programs or family child care centers do if there's an outbreak of COVID-19 among children or staff?
Kate, do you want to answer that?
Sure. And this is opinion, right? Because there's not guidance right now coming up, but they should probably close and quarantine and take good care of their health and so they should quarantine themselves. They should probably close as a program, and of course that depends on the program size. If it's a very large program overall, maybe they didn't come in contact, but they should track who the children and family were in contact with, and do that notification process through their local public health departments that are ostensibly prepared for this, and they should, when they can return, they should do so with all possible precautions in place. As Sam pointed out earlier, as our providers pointed out time after time after time in the research, they cannot not have intimate physical contact. And so the likelihood, childcare centers, if they saw COVID, would be a likely place for it to spread very quickly. And so it needs to be taken with most seriousness.
COVID is, if we know one thing, is that it is a contagious disease, right? And any contagious disease in a child care program needs to be reported to the Department of Health and Human Services. Likely, it will result in all the things that Kate just described, and we should be glad, any of us, that those kinds of precautions are in place.
Okay, Sam and Kate, we have a question here. We work in a preschool classroom. How do you think the fall classrooms will look?
Well, I guess I would say they will look small. I hope they will look smaller. They will probably be quieter. There's a lot of the relearning that's needed here is the relearning of routines in classrooms, of trust, it's this terrible missing of the teacher and of peers, that kind of thing. We all hope that everyone will be healthy to come back. And so far, Nebraska has had a very low number of fatalities, and that is something to feel blessed by. But otherwise, what we're going to try to do, what everyone's going to try to do, is to move back to where we were, but not, from my point of view, not in a hurry. Do it gradually, and recognize that there will be needs that you might have thought a 4-year-old doesn't have anymore. So he's acting like a 2-year-old. Well, he's acting like a 2-year-old because he's scared, because he's worried, because he doesn't know what to expect.
Here's how here's how I hope they look. I hope fewer children are playing and learning with toys and books, and playing outside and inside with adults who are talking tenderly to them, using a lot of language in a calm, warm voice, because those adults are not afraid of getting sick because they have health care and health insurance and paid time off if they do get sick. The children are mostly happy and not anxious and learning because they're adults who care for them, and the teachers who care for them are well cared for by the infrastructure of our communities and with whatever supports our government and our private organizations can offer. So that's what I hope for children, that they almost can't remember what it looked like. That's what I would hope.
And you mentioned anxiety. We're going to do 2 more quick questions. One is, do you know of children's books that would help students deal with anxiety?
Kate, can you help with that?
So here's the thing. I'm not going to list them off right now, but I'm going to get some to you, Erin, and we'll send it out with our email, because there are some fantastic children's books on worry. And there have been some new ones released specific to this COVID response that I'd like to dig up and send with that, because one of the best things you can do with young children in the context of worry and anxiety is to read a story to them about someone who's experiencing something similar, and talk in warm, honest ways about those emotions. We know from research that one of the best ways children cope with emotions is to have someone who cares about them talk about those emotions in a sensitive, honest way. Books help that. Mm-hmm.
We'll get those from Kate and include those in our follow-up email, which we plan to send to all attendees on Monday. Here's the last question for Kate and Sam. Do you see the pandemic changing how society views and supports the early care workforce, better pay, wellness, etc.?
Well, I can tell you this, I can promise you this, we will make sure they hear about it.
Yes.
And that's our commitment. Our commitment as an institute, and largely our commitment with colleagues throughout the state, is to improve the working conditions of the workforce so that they can concentrate on doing the best possible work they can with young children. We will not just say, wow, I'm glad this is over, now let's get back to where we were. We are going to make this into something that we will not forget in a lot of ways.
Great. Thank you for the question and answers. I am now going on mute. Sam, if you want to give any closing remarks, and then Lori will finish us up. Thanks.
Thank you, Erin, and thank you, Kate. There's not much more to say. I think that we've given you a sense of how we feel about this, and we at the Institute spend time every single day, for sure, on COVID-19 issues. We've learned a lot, and we've learned a lot from our colleagues throughout the state. And these are people who you can find online: Nebraska Children and Families Foundation, First Five Nebraska, the Buffett Early Childhood Fund, one of our colleagues, obviously, and then our own Institute website, which you'll see in a moment. There are resources on all of these locations, and many, many others that they will take you to nationally. There's a lot available, a lot of help that you can get. And I guess I would say to you that as it becomes more possible for this state and this nation to go back to normality, and I hope that that is soon, then I expect us to be seeing more and more children in early care and education. And all of us need to do what we can to help those who help us. And I'm going to turn this back now to Lori Byrne.
Thank you so much, Sam, and thank you from both Dr. Meisels and Dr. Gallagher for all those insights, and Erin, thank you for leading the Q&A and for all the great questions. We are so fortunate at the University of Nebraska to have such strong leaders in this area. I'd also like to thank all of you for attending our webinar, and just to remind you that a recording will be provided in a follow-up email next week with those resources that we referenced as well. And if you're interested in learning more about the Buffett Institute, please visit their website, and the URLs will be listed at the closing of section of the screen. So thank you again. I hope everyone has a wonderful day on this beautiful, sunshiny Friday afternoon. So thank you again for joining, and have a wonderful weekend.